Hi, I am Dr. Narayan Swami, MBBS, MD Pediatrics, having 22 years of experience in the field of pediatric medicine.
Hi, I am Dr. Vinota, MBBS, MS OBG, obstetrician, gynecologist and infertility specialist, having 20 years of experience in Athreya Hospital.
Together, we are the founders of Athreya Hospital, Chandapura, Bangalore. As such, Chandapura, falling in the outskirts of Bangalore, has a little less planned infrastructure, and it's overcrowded, and it did require a lot of healthcare support, so which made us choose this locality.
And we also belong to the same area. So it was when I was a childhood, I used to go to my grandpa's house through this road. So I wanted to serve this community here. So we thought we'll have a setup here, and we started in 2006.
When we both had a chat, somewhere in 2005, while she was pursuing her MSOBG, our frequencies did match when we had this concept of starting off a hospital. So that too in her locality, or her hometown, or village. So that's when when I expressed her my idea of starting off her own setup, she also did cooperate, and it was almost like a one voice. It became like a one voice within short time. So
We
that's
both
how,
have similar mindsets, so we had like, okay, we can do it, and we had to start from a scratch.
and moreover the pediatrics and maternity, the combination also made us become early successful, or whatever you can call.
Yeah, and even our professors are also encouraged us. OBJ and pediatrics makes a very good combination, and it will be a better this thing for the people.
Somewhere in 2005, when we both started thinking about where to start our own practice. So having OBG and pediatrics as a combo, we believed that makes a complete package for anybody as a mother and child. So, and then we started thinking about the location where to start off, and Chandapura we chose because it is her hometown, and it is outskirts of Bangalore, and again having less doctor population ratio. So we did set it up here.
We always started from a sketch, and we had a vision that we'll have to make it big. So we started with a small clinic, and then we are here with an 100-bedded hospital. We have been dealing with many complicated cases here because there is only one referral center here, and we started with a small clinic. In that small clinic we had with the 10-bedded hospital we had started. We started conducting deliveries there. We handled all complicated like gestational hypertension, preeclampsia patients, diabetic mothers, all those cases we handled. Then we thought, okay, let us do little more to the society. We needed proper ICU setup. So then we thought of going for a bigger setup and hospital, and we have handled many complicated cases. Recently one cases where we saw a fibroids patient with pregnancy, and she was so apprehensive about continuing the pregnancy and all. She had multiple fibroids in her uterus, and she was pregnancy was positive, and she came to me, she came to us with so much of stress, all those things. So we counseled her, told her to continue the pregnancy. So max treatment, everything was given, and we did myomectomy, cesarean myomectomy also. We removed around 1.5 kgs of fibroids, along with the baby 2.5 kgs, very healthy.
So totally 9 fibroids.
Yeah, the large, almost total weight was 1.5 kgs. The largest fibroid was around 15 to 20 centimeter size fibroid was there. And one more patient I remember, they're married for some 20 years, no pregnancy, and they conceived with our treatment here. And unfortunately, she had ruptured her membranes at 6 months of pregnancy, that is around 26 weeks. and we saved that baby with our NICU team support, and baby was there for 2 months, healthy, without any sequelae.
Yeah, baby is coming for the follow-ups
For
now, for
follow-ups
the regular
also now.
vaccinations. Doing fantastic. It's almost 7 months now. Doing wonderfully good.
And also recently one patient, she had come with a loss of appetite and weight loss. Then we examined her, her abdomen was looking 9 months pregnant uterus size. When we did a scan, she had an ovarian mass. And with a minimal incision, we removed that 9 kg tumor with a minimal incision. And that was also recently operated. So ultimately what we feel is, ultimately the patient should be happy, satisfied, and would have got proper treatment.
So we have successfully delivered 8,500 babies so far in our journey of 16 plus years, and having zero maternal mortality, and all the credit goes to the OBG department.
We are happy to serve this community here and take care of the people here.
Of course, the people have cooperated so very well, and we are happy that the patients have accepted our treatment, getting
And
the
even
best.
during the COVID times, when the pregnant ladies who were COVID positive also, we have operated without any hindrance.
And I admire her contribution in her department. She's she never refused any COVID positive cases. She dared to attend on any case, even during the COVID, and she herself suffered almost every wave of COVID.
Yeah, we had, though we had already shifted because the pregnant ladies, we didn't want to infect this thing. We had shifted our OPD to the other building only.
Adjoining building.
We had shifted there. I used to see the OPD and all the way run from there, come to this building, operate the cases. Starting we were little scary, but we used to wear that mask and all. For few days I started wearing, then I was not comfortable without this thing, basic protection. We used to operate the cases.
No, we were lucky. We were lucky
Yeah.
that we did not get killed, but we were successful enough to sail through that waves. The biggest challenges which we together faced since inception was the expensive infrastructure and its maintenance, and getting that quality, skilled, experienced workforce. That was ultimately challenging because it is outskirts, as I earlier mentioned. So it was not so easy to get the good quality working crowd all the way from city center. So for that we had to offer two very big, and even the infrastructure was a bit expensive for anybody to start off.
Doctors usually they have a setup more in the central of the Bangalore area. They would like to serve more there than coming to a rural side.
It's more organized there.
Yeah.
So here having a little less organized infrastructure, they do feel little inconvenient to come and settle in this area and serve this crowd. So for which we had to make our own arrangements and keep them comfortable as far as possible, and also meet their their demands, or maybe to give the best whatever we could. And with all this, we were able to satisfy our patients so far, and we are proud to see their smiling faces, and and it has been a successful journey throughout till now.
And seeing the patients smile on their face, that is the most happiest thing we feel, and patients thanking us. Many childless couples have been so
Conceived.
happy, conceived with the treatment after trying treatment many times outside for few years, so that become pregnant. Many patients would come and fall at my feet, like they would be so happy seeing they'll just flow, the tears will just come up from the patient once they see that pregnancy test is positive after trying from so many years. And many patients have also asked me, why don't you open a setup in Bijapur, Bidar, there, why don't you come monthly once, like that. So many patients have shifted the location also.
Yeah, for
like
their
few
for their final months of
infertility,
pregnancy.
yeah, infertility treatment. They have shifted from Chitradurga, from Malur, from Hebbal, Yelhanka also they are coming. They have taken a rented house,
Rented
stayed
house and
here
stay here.
till they become pregnant, take treatment, and finally patients are happy, we are satisfied, that's it.
As we continue to grow with OBG and pediatrics, and after we started getting more complicated cases, we did require multidisciplinary approach. So
Because we
especially
used to deal with more of a complicated cases, so physician necessity was there, and fetal medicine specialist was required here, and in this locality there is no fetal medicine specialist. So the high risk pregnancy cases we used to deal, so we always required a physician, fetal medicine specialist, radiologist also was required, and to deal with the complicated surgery cases, so we needed a general surgeon and a
especially for the
laparoscopic
gynecology
surgeon also.
cases associated any gynecological issues or surgical issues, or even diabetology maybe. So this made us again to sprout with other departments. So then further we added our orthopedic team. So orthopedic, cardiology, dermatology, ophthal, ENT, audiology, physiotherapy. Now, having said
We
that, almost
always
all the
dreamt of
specialities we
treating
have.
the patients under one roof for all the diseases.
So, in our journey of continuing to excel in healthcare and also our contribution towards the mother nature, so we wanted to introduce something unique in in saving or preserving the natural resources. So, on that context, we did introduce a year back paperless system. Our entire hospital, Athreya Hospital, is today paperless. We do not use a single paper either for prescription or maintaining any kind of medical records or our IP papers.
He is almost more of, we are environment friendly, and he has almost planted around 3,000 trees in and around the
Around our
hospital
hospital.
and the area where we live.
Technology today, it's almost ruling the entire world. So even we are not far away from that. We do have our sophisticated medical equipments, starting from the ultrasound scans to the CT scans, or particularly in every area. So these sophisticated gadgets, which are also today almost are artificial intelligence friendly, we are they are able to connect all the consultants to one platform, and we are able to provide the best to the patient. As I said, it is on the tab, and again we are able to save all their data, medical reports, and the previous prescriptions or treatments taken elsewhere, everything getting documented onto the medical records,
And we
electronic
need
medical
not
records.
wait for 24 hours for the scanning reports and all. We can get it just like that with the benefit of this teleradiology and all. And see, before there were like hardly maternal scans were done. Hardly they used to go to the doctor also. So many complications, so much of maternal mortality was there
True.
before in India. And now the maternal mortality is gradually reduced with this multidisciplinary approach also. And with the help of the scanning machines, eye-hand scanning machines and advanced blood tests and all, we can detect the abnormalities in the baby and we can take a call. We always want an future expansion with the changing trends. So we are looking forward for a further step. So we are expecting lot of support from the community.
Challenges keep coming. We need to attack any critical case in the same Josh. So, being confident that the technology would not cheat us, and the the sustained support from the society remains with us. So we have been coming all these years successfully, and we hope to continue as well with further expansions in terms of healthcare.